When we talk about, initial treatment, for example, oftentimes we will start with the pills. And we have 4 pills that are FDA approved for this reason. We have sildenafil, tadalafil, vardenafil, and avanafil. And their generics and brand names are listed on this screen. Now, these medications increase blood flow to the penis, but you have to be aroused for this to work. So if you go to the grocery store and you popped a Cialis an hour before, I don't want you to worry that you're going to be walking around getting some avocados and get an erection. You do have to be aroused to stimulate that nitric oxide pathway. Now, there are key differences to these medications. Let's talk about how we take them in relation to eating food. Viagra and Levitra, you should take on an empty stomach, and you definitely don't want to take those medications after eating a fatty meal. The other medications, it doesn't matter. In terms of how long these medications last, Cialis is the one that really stands out in this regard. So for some people, this medication can cause an effect for 24 to 36 hours. I'm not saying you'll have and maintain the erection for that long, but it'll have the ability to work in your body for up to that long. The other medications work up to 6 to 8 hours. So they're very similar in terms of the duration. Cialis stands out here. FDA approved oral dosing. So all of these medications are used PRN or on demand before sexual activity. None of these medications cure or reverse erectile dysfunction. Cialis stands out a little bit in that because it lasts so long, you can take a lower dose on a daily basis depending on what you're treating. If you want to have sexual activity, let's say 3, 4, 5 days a week and maximize your spontaneity, then in many men we'll put you on a low dose of Cialis so that it's always somewhat in your system. When we think about side effects, well, side effects for this whole class of medications include, a laundry list here, but headache, facial flushing, nasal congestion, back pain, reflux, blurry vision are the main ones here. Vision loss, hearing loss are very uncommon. Priapism is on the box. That really only happens if you take too much of the medication or if you take it with other medications like trazodone, where it can really increase your risk. So, any of these medications, it's not that one necessarily works better than another. I have some men who say Viagra works better than Cialis for me and vice versa. In terms of side effects, some people have side effects with Viagra and not Cialis and vice versa as well. If you have side effects with these medications when you initially start, oftentimes when you take them on multiple occasions, those side effects can get better. Other considerations are going to be if you're also being treated for an enlarged prostate, because Cialis, that low dose that you take it every day, is actually a really good therapy to treat lower urinary tract symptoms like weak urinary stream, having to strain to urinate, things that we associate with having an enlarged prostate. And also cost is important. So, in my practice, or really in everyone's practice, with those 4 medications, the Stendra, that's the new kid on the block. So that medication is going to be one of the most expensive. In terms of Viagra and Levitra, they're very similar in how they act in the body, but Levitra is going to be more expensive. So for that reason, I kind of put Levitra on the back burner. And then it's really between Viagra and Cialis. And based on those cocktail napkin sort of summary sheets, you would say, well, why doesn't everyone take Cialis? Well, I initially used to give Viagra way more often because Cialis was cost prohibitive. But if you use like coupon or medication assistance programs, it actually takes the cost difference out of it. And you can actually get, Viagra and or Cialis for very cheap prices, like less than $1 a pill, which is great.